the goods. And the cost of these are this.
There's a range. And I always tell people, it's just like renovating your bathroom. It depends on how much square footage there is.
I love that.
And it depends on what work needs to be done.
And nose jobs all the time, but do we really know what goes into these procedures? Well, here with the truth about popular plastic surgery is Dr. Zell Krajden. Welcome to the show.
Dr. Krajden, how long have you been a cosmetic surgeon?
So Jesse, I started medical school 21 years ago, and I started my surgical training 17 years ago. I've been a board-certified plastic surgeon for 12 years now.
So you have seen it all.
Yeah.
You've seen it all.
I don't know if I've seen it all, but I've certainly been asked it all.
Oh, good.
Yes.
There's nothing we won't be able to stump you with.
Almost nothing.
I love
I love it. All right, let's get to it. All right, so let's go through some of the procedures.
Yes.
The first one we want to talk about is a tummy tuck. What is a tummy tuck? Like, break it down, and how much does it cost?
Got it. Tummy tuck is one of the most common plastic surgery procedures performed in North America. It's also called an abdominoplasty. It's when you excise or remove extra skin, extra fat, reposition, make a nice innie belly button, often contour the abdominal muscles as well to create a nice smooth contour.
Now, who typically asks for that type of procedure?
I mean, the common patient would be a postpartum female, so female between the ages, let's say, 35 and 60.
Okay.
Some patients are patients who have lost tremendous weight, and about 20% of my tummy tuck patients are males who've lost quite a bit of weight and have less than ideal skin tone.
I'm sucking my postpartum stomach in very hard right now.
She has no postpartum tummy, please. All right, so let's talk about pros and cons of a tummy tuck.
So in terms of the big advantages, complete contouring of the torso, the abdominal wall. Removal of skin, removal of fat. Sometimes only a pound or two of skin. I had a patient 2 weeks ago, I removed 9 pounds of skin and fat. So for someone like her, in 6 weeks, she'll be able to wear tighter t-shirts, sweater dresses, and have a completely different contour. The main con, there is a permanent scar. We do put it as low as we can at the bikini line. And afterwards, we can treat it with injections, lasers to optimize its appearance. And there is some discomfort and recovery period, like with any surgical procedure.
Okay, can we talk about the chicken, the arm, the loose underarm?
Yes.
Is there a procedure for that?
There are. So an arm lift is also called a brachioplasty. It's less common than a tummy tuck. It's usually reserved for people who've lost a lot of weight. When there's extra skin and fatty tissue. With that procedure, there's a scar down the arm. So on the inside of the arm, often from the armpit to the elbow. So again, a fairly lengthy scar.
You won't see that.
It's hidden in the posterior kind of crease of the arm. Now, for most women who come in with a little bit of skin or a little bit of fat, those are people who are great candidates for those non-surgical modalities.
What's a little bit of skin when you say that? Because I'm grabbing my meat.
I think it's like a lot of women, as we age, the skin, especially on the arm, starts to droop a little bit.
For sure.
Right?
Gravity affects everyone, and everyone hits that edge of the wedge differently, depending on their genes, weight gain, weight loss, hormonal changes. But a lot of arms can be treated with liposuction or those non-surgical modalities that I just talked about.
Oh, wow.
All right, so next we're going to talk about the Brazilian butt lift.
Yes.
Can we get into this?
For sure.
I want you to describe what it is, how much does it cost, and when can I get my... No, I'm joking.
So, I mean, this is not a new procedure, a new technology. However, 20 years ago, this was being done mostly in South America. It was not called the Brazilian butt lift. And really only the past 5 to 10 years, especially on social media, it's become this hot procedure, especially in the United States. It's been popularized by different celebrities who have that.
I can't even think about
Who could it be? Who could you be referring to? Does it start with a K? The Kardashians, perhaps?
It's possible. So, I mean, when you look at celebrities, they influence all parts of culture, right? All parts of culture and fashion and whatnot.
literally all parts.
Yeah.
Sure. In the 1990s, you were a hairdresser, everyone wanted Jennifer Aniston's hair,
Yeah,
right?
right.
So
Yes.
whoever's the hot celebrity really drives what's going on in people's lives.
So
good
how
or bad.
common is it for people to come in and ask for celebrity features?
Pretty common, but you're hoping that they're using that as not a guideline, but really more like a general trend. Hey, I really like the look of George Clooney's chin. What can I do? Not, I want to look like
George Clooney.
Yeah, because
Right.
That's never gonna
obviously-
happen.
They're not realistic.
Yeah. And to go back to the Brazilian butt lift, is there a difference between a butt lift and butt injections or an implant?
For sure. So when you think about a lift, you think of elevation.
Yeah.
So again, going back to that massive weight loss patient who lost 100 pounds, you can do a posterior body lift. We're actually lifting up the buttock, skin, and tissue.
But you'd have to have a decent-sized buttock in the first place
Exactly.
to lift. Okay.
When we're talking about the Brazilian procedure, it's more augmenting the buttock, usually with fatty tissue. So you do liposuction on other areas of the body, stomach and hips, and you're transplanting or grafting onto there. And the goal is to create a curvier, more proportionate figure.
Dr. Cronston, in your professional opinion, do the Kardashians have butt implants and or lifts?
You know, it's hard to know. It's hard to know. Just like with airbrushed makeup and Photoshop,
don't know.
I do think the vast majority of people in Hollywood have had something done, whether it's surgical, pharmacological, makeup. I'd say the vast majority of them are enhanced in the way that we see them. Because if you look on the front page of a lot of these magazines, seeing them in their real-life ways, they don't look so fabulous anymore.
So
Right,
true.
got it. Wow. Thank you, Dr. Cronston.
After the break, Dr. Crabston is answering more of our questions.
I don't believe this one. The 5-minute
I
nose job?
really think it's gonna like fall. I'm just visualizing. I'm like, it's just gonna get lower and lower. All right, we're talking to plastic surgeon Dr. Zell Crabston to find out what really goes into common cosmetic surgeries, because it's not just a pretty before and after photo, right?
Exactly. You have to be realistic about the procedure, your own anatomy, and what that outcome is going to be.
Okay, I want to talk about nose jobs because I have an obsession with nose jobs
Why? You got
because
a
I have
perfect
a
nose.
strong nose, and I've always, like, since I was a teenager, like, wonder what I would look like with a little Michael Jackson nose.
Yeah, we all did.
You know?
Yeah.
So how much does it cost? Who's getting them?
Well, first of all, you would look fabulous with that, obviously, is the answer.
With a Michael Jackson
Yes,
nose?
for
Thank
sure.
you, Dr.
Yes, of course.
Very professional response.
So, I mean, when you look at any part of their body, including the face, you have to look at their symmetry. You also have to look proportionate. So someone like you have nice high cheekbones, you have nice, big eyes. For you, your face perfectly matches your nose or vice versa.
Thank
So
you.
if you look at, again, options, option one I always tell people is to do nothing, is to stay conservative, stay true to your own anatomy and body. Option two is to do something about it, and that becomes surgical or non-surgical. With surgical, the main procedure is called a rhinoplasty, and the main is a reduction rhinoplasty. We're helping remove that dorsal hump in towards there, and then often shaping the tip as well.
Right. And the cost of these are this was...
There's a range, and I always tell people, it's just like renovating your bathroom. It depends on how much square footage there is.
I love that.
And it depends on what work needs to be done.
Yeah.
And it's a good analogy.
Can you actually do a 5-minute nose job? Is that a thing?
Well, I mean, I prefer to call it an injectable rhinoplasty.
Okay.
So the main type of filler on the market now in North America is called hyaluronic acid, and most of the fillers that you've heard about in the media use this substance. It's a dissolvable, semi-permanent substance, so it lasts between about 1 and 2 years, and you can inject it in certain people's noses to augment and change it. So just like people can have filler put into their lips to make their lips bigger and fuller and have a nicer contour, in certain people's noses, you can inject filler to optimize the anatomy. And again, this is temporary, lasts 1 to 2 years. Not everyone is a candidate for this, but often for certain nasal appearances or deformities, which I don't like to call them, you can improve the appearance quite a bit.
Wow.
That's incredible. All right, so next we're going to talk about the eyes.
Eyes.
Because it's the first thing that we see. So you can get your eyes done. Like, what procedures can you get done, and how much does it cost?
The eyes, again, are the windows to the soul. So, I always tell people, everyone ages at different rates. But everyone hits the edge of the wedge at some point. So everyone ages at some point.
Yeah.
And often what happens with people's eyes, there's droopiness of skin, there's extra skin, there's sun damage, and often the fat that we all have in our faces deflates and descends.
Yeah.
So in terms of surgical procedures, it's called a blepharoplasty. It can be done on the upper lids or the lower lids or both, again, depending on someone's anatomy and their goals. And the procedure is done to remove extra skin, redrape fatty tissue, and give a more youthful appearance to the entire periorbital region. And often you'll augment that with Botox, fillers, laser treatments, and then things like makeup afterwards.
Right. I just don't like the idea of, like, hacking into the eye.
Number one, it doesn't
Sorry,
involve the actual
hacking.
The technical
There's
term
no
is
hacking.
There's no
into
hacking.
the eye.
So, this is done very delicately, and it's all superficial to what you would consider the globe or the actual orbit. So it's the
Right.
skin and muscle envelope around the eye.
Okay. And if you don't want to go in for a surgical procedure, is there anything that you can do?
There are non-surgical things I find for the eye area. They're more modest. Again, you're looking at a combination of Botox and fillers, and that's more in your younger patients, where they have early age-related and sun damage changes, and you can improve things. But certainly when there's extra skin and fatty tissue, there's only so much mileage you'll get out of those needle-based interventions.
Got it. Wow. Thank you, Dr. Crabston. This has been eye-opening.
Yes.
Really. And I'll see you tomorrow when I come in for my Brazilian butt. Of course. Done. After the break, no need for surgery. I am transforming lives in just 2 minutes.
No, that was super. I like what you said about the butt, because I know that's a big thing.
Here's what's coming up on the